Welcome to this Cronkite News Special. I'm Kevin Gessner. Thanks for joining us. From borderlands to business, from education to law enforcement, our Cronkite News staff works in teams to deliver news on specific topics of interest to Arizonans. Tonight, we highlight some of our top stories on the consumer beat. Stories about protecting your money, identity, and livelihood.
For cancer is extending beyond the medical field and into the legislature. Cronkite News reporter Madison Stark has details on a national organization pushing to make a difference here in Arizona.
Today, the American Cancer Society hosted its Cancer Action Network Day at the Arizona Capitol. Two issues they want state lawmakers to tackle: tanning beds and teen smoking. Many cancer survivors, health professionals, students, and volunteers gathered at the Capitol for the opportunity to meet with Arizona legislators and seek support for two bills aimed at reducing cancer risks in the state. One bill hopes to reduce the risks of skin cancer by prohibiting minors to use indoor tanning beds.
With melanoma, it's a pretty aggressive cancer, but I'm seeing it a lot more in younger people versus older people. And we know that younger people are getting melanoma because of increased radiation exposure. And essentially, it's because they're using tanning beds at younger and younger ages.
Deborah Aronero Garcia is a melanoma survivor and cancer nurse who says it's surprising nothing has been done to protect the health of Arizona youth in this way.
Really important for me, being here in this state that has one of the highest rates of melanoma in the country, to stand up and have a voice and do something about that.
Red Mountain High School students also had the opportunity to voice their support for a bill that would increase tobacco regulations. The bill would increase the legal age to purchase and possess tobacco products from 18 to 21.
So many people are starting to smoke way younger, and they're being affected. They're showing people that it is okay to smoke when you're younger, when it's really not. It can affect so many more people, and we're allowing that to come back into our schools.
In meeting with legislators, students hope to show the impact these laws could have on the entire state.
We live in Arizona. We live with these people, and they're not just affecting themselves, they're affecting others. And we need to come together as a community and just so much support.
Supporters of the proposed tanning bed and tobacco legislation need bipartisan clearance. Both bills were assigned to committee. In the broadcast center, Madison Stark, Cronkite News.
Resources are precious, and how they should be distributed to help people who are homeless is the mission of the annual Point in Time survey. Mari Nelson shows us how teams of people reach out to those living on the streets across Maricopa County.
On one of the coldest mornings of the year, volunteers set out before sunrise to count and survey people who are homeless.
I hear so many cries from people. Why don't they listen to me?
The Point in Time count is a chance for the community to listen and help. Every year, teams from the Maricopa Association of Governments count the number of homeless and survey their needs, including mental and physical health.
It's such a sense of community to come out here and speak with individuals experiencing homelessness and just get their personal stories. Every time I interact with an individual experiencing homelessness, it's always something positive for me.
According to the county agency, the number of homeless without shelter in Maricopa County almost doubled from 2014 to 2017.
The Point in Time count helps us kind of just capture the data around our programs. Are our existing programs working enough for them? Is there room for improvement? Are there things that we need to maybe change?
Sometimes the help comes right away. Once the team learned Shockley is a veteran, they called a service that helps homeless veterans.
Just sometimes people just need someone to listen to them or hold their hand.
The service sent a van that picked up Shockley and connected him to resources. In Phoenix, Mari Nelson, Cronkite News.
The final result for the 2018 Point in Time homeless count will be released in May.
Tonopah has about 60 residents, dozens of farm animals, and a lot of dirt roads. But Microsoft's Bill Gates is about to turn that far West Valley community into the first smart city built from the ground up. Madison Miller explains that some believe that could be an investor's dream.
Technology takes over more and more facets of our life every day, and so maybe this city would accelerate some of that, and I have no problem with that.
Bill Gates, the co-founder of Microsoft, just bought 25,000 acres. That will turn a barren area into a smart city. The plans include 80,000 homes run by iPads and iPhones, streets filled with self-driving cars, and be wired with fast-speed data networks. Real estate agents say it's already increasing home prices.
An impact of something so large going out there, I think, might make a really big difference to the community. And we're hearing sides that, they don't like the idea of growth, and yet growth is going to happen.
The development is empty now, but is expected to be booming over the next decades.
And so as soon as you start putting somebody's big name with a project, we seem to see a lot of that speculation.
But real estate expert Rick Merritt says the area will take 2 years to develop because a new interstate needs to be built.
Major developments like that, they grow very slowly. They may grow a couple hundred units a year or something like that. So it's not going to be an overnight thing. And it'll really be, the major developments will be contained within those master plan communities.
But dairy farmer Dan Boschma is ready for the smart city.
I think that's a fine idea.
In Tonopah, Madison Miller, Cronkite News.
According to Belmont Partners, 3,800 acres will go towards office, commercial, and retail space, and 470 acres will be used for public schools.
A new bill could require safety testing for medical marijuana for the first time in Arizona. Arizona State Senator Sonny Borrelli introduced Senate Bill 1420 today. It would require testing marijuana for things like chemicals, pesticides, and mold. If passed, it would also lower the $150 fee patients need to pay to get a medical card to $50 and $25 for a renewal.
Another newly proposed Senate bill on medical marijuana regulations is facing some backlash from supporters. Mari Nelson shows us how the bill would further regulate the medical marijuana industry in Arizona.
SB 1060 would make it a federal crime for any publication to post anything about an Arizona medical marijuana dispensary without verifying its registration and address. It would also make it a crime to publish a dispensary address that is different from the one on the certificate.
We've put this program into play, and now we can't even have free range to advertise.
Arizona voted to legalize medical marijuana in 2010. Jared Neibauer, who is part of the marketing team for the Nirvana Center, thinks that being able to advertise and publish freely about marijuana dispensaries is a big factor in the industry's success.
This is a good roadblock that is going to hurt us.
If this bill passes, any publication found to violate these new regulations could be fined a minimum of $10,000.
Republican Senator David Farnsworth didn't return multiple phone calls and emails requesting interviews regarding the bill. But David Wisniewski, chairman of Safer Arizona 2018 Cannabis Legalization Action Committee, believes this proposed legislation would violate the Constitution.
I absolutely believe what he's doing is a First Amendment violation. Anybody should be allowed to say this store is open if they're open for business, and it's the burden of the state to see if they're a legal business or not.
These regulations don't just apply to any business, only Arizona medical marijuana dispensaries.
I believe Senator Farnsworth is completely wrong on all accounts with his bill. If you look at other states that have legalized marijuana, they've all taken baby steps, but they're taking other steps to make more freedoms.
In Phoenix, Mari Nelson, Cronkite News.
For the homeless, getting back into the workforce can be a challenge. That's why one southern Arizona community is planting hope. Reporter Adriana De Alba traveled to Cochise County, Arizona, to find out how a greenhouse is changing lives through gardening.
On the southern rim of Arizona, nestled in the mountains of rural Bisbee, you'll find the Tin Town Resource Center. Beyond a homeless shelter, it's a place to work and find one's purpose. Ian Dorfey brought the idea of this greenhouse to life. The project hits close to home. At one point, he too was homeless.
There are not a lot of opportunities for people that are poor and homeless here. And I wanted to see there be some genuine opportunities.
It's an emotional mission for Dorfey, and it provides an opportunity for the homeless community here to run the greenhouse as a business by growing and selling their own produce.
They keep you busy, give you a sense of direction.
Sowing the seeds every morning means a fresh start for clients like Brenda Sandoval.
I'm a different person. I look at everything different. I feel better about myself. And I'm the person I used to be, I think, before I got lost.
Brenda was homeless for 11 years and used drugs. But here, she celebrates 6.5 months of sobriety.
I can't believe that I didn't find someplace like this sooner. And I think of all the time that I wasted not doing anything, and it's ridiculous.
I know that I may be changing lives, but I don't look at it that way. I do these things out of a love for God.
The issue of homelessness in rural areas like this one is often overlooked. The coalition here finds that access to resources presents a unique challenge.
We really absolutely have no government funding whatsoever. It's all corporate donations and individual donations.
In 2017, the Arizona Department of Economic Security estimated there are more than 1,700 homeless individuals in rural areas of Arizona.
I'd like to see more city involvement with rural areas, instead of counting on the rural areas to depend on themselves.
Meanwhile, the clients of Tin City continue to move ahead through their own efforts with a newfound confidence and hope the fruits of their labor will lay the groundwork for a promising future. In Bisbee, Adriana de Alba, Cronkite News.
Those involved with the project say it's the first of its kind in Cochise County. Though financing is tight, they continue to serve the homeless only through private donations and volunteers.
As journalists at Cronkite News, we report on stories that matter to you by focusing on the local impact. We dig deeper and work tirelessly to keep you informed.
Live in Wickerburg.
Live in Los Angeles.
In Cleveland, in Washington, in Louisville.
From Jerusalem.
Live in Philadelphia.
From around the world to right here in Phoenix.
At Cronkite News, we report the facts and stick to the truth.
It's been a bad year for the flu, not just in humans, but in dogs as well. Cronkite News reporter Jamie Fossenkemper explains what Animal Care and Control is doing to keep a flu-like illness called Strep Zoo from spreading through its shelter.
2 weeks ago, an infection broke out at the Maricopa County Animal Care and Control Center East Valley Shelter, an infection nicknamed Strep Zoo, and it's infected 30 dogs. One died.
Streptococcus zooepidemicus, what people are normally calling Strep Zoo, is an uncommon bacterial infection that causes respiratory disease in dogs.
This infection is rare, but can be found within animal shelters because of their living conditions.
Strep Zoo is not a common respiratory tract infection in dogs, but you can see it in shelter situations when dogs' immune systems are suppressed and they're stressed out.
Animal Care and Control Center has had the most cases, and they are taking steps to keep it from spreading.
So what we're trying to do is we're keeping a close eye on the animals that are still healthy.
Taking preventative measures, Animal Care and Control Center will now be vaccinating as well as medicating all of their animals at their East shelter against the strain. Although this disease can be fatal, it is also treatable.
If they can get into a quiet, stable environment with antibiotics, this could be gone in about 10 days.
To help those animals find homes, the shelter is reducing adoption costs, and in some cases, the fees will be waived.
So what we're doing right now is we decided we need to clear space here and space in our other shelters just in case we get an outbreak that we have to go into a quarantine situation.
Giving the animals more breathing room. In Tempe, Jamie Fossenkemper, Cronkite News.
Dr. Ware says pet owners don't need to be concerned about Strep Zoo. It's rare in places outside of animal shelters.
When you think of vintners, you probably think of rolling hills of grapevines, but for some, winemaking is a home-based pastime. Cronkite News reporter Amanda Slee shows us this extravagant hobby.
I like the romance of it. I think it's fun.
Louise McConey is one of many home winemakers here in Arizona. These hobbyists create their own wine for personal use.
back in 2011, I was on a cruise, and we did a day trip to a winery from the cruise, and when we walked into the wine cellar with all the barrels in it and everything, the smell was what got me. And at that time I thought, I have to be more involved with this somehow.
This hobby isn't an easy one, on top of a full-time job. Tom Messier tells us it's always an adventure, especially during harvest season.
You're doing it 15 hours for a day, sometimes 2 days in a row, because you get the grapes or you get the fruit, and you got to process it as fast as you can before it goes bad.
The hardest part for home winemakers is getting the small quantity of grapes, because the vineyards prefer to sell large quantities to licensed winemakers. However, the grapes are also the best part about Arizona.
What's special about Arizona is that the grapes here are great. The different elevations and the terroir makes the grapes primo.
Since home winemakers don't have a license to sell, they find other ways to share their passion.
It's just a way of sharing a bit of myself and whatnot with the people around me, the people that I love.
In Phoenix, Amanda Slee, Cronkite News.
This spring, home winemakers will be participating in the first annual Arizona Emerging Winemakers Competition. At the competition, they will receive feedback on how to improve their craft.
Arizona is joining a long list of other states that have passed a law that shields people who call for help for an overdose victim, meaning if they were discovered with drugs, they won't be prosecuted. As Tyler Finger reports, some believe it will save lives, but others think it's a get-out-of-jail-free card.
It's a life or death call.
People shouldn't die over a bad decision.
Jay Fleming is a former undercover narcotics investigator and has seen our nation's drug crisis firsthand.
When I worked undercover, if you're doing drugs and something goes wrong, anything, you're not going to call police. I mean, they're the last people you want to see, especially an overdose, because, everybody's got drugs that are theirs.
That fear of prison means the person in need may not get the emergency help they need.
I understand drug war is about arrests. The more arrests you get, the more money you get from the feds. But, that shouldn't even come into play when somebody's going to die.
Governor Doug Ducey just signed a new law that would allow so-called Good Samaritans to call for help without the fear of arrest. Arizona joins a long list of other states who provide these protections. Now just 9 don't.
It's important to push because I think it will save lives. It is very good because there is a crisis. There is an absolute opioid crisis.
But not everyone is on board with this. Republican State Representative Eddie Farnsworth told the Associated Press it's a get-out-of-jail-free card. For Fleming, though, he's seen the reality that addiction is a struggle.
Everybody thinks if you use heroin, you're a bad person. These people get addicted, and there's not much they can do.
Now a simple phone call could save a life. At the state capitol, Tyler Finger, Cronkite News.
The Good Samaritan law, along with other aspects of the Opioid Epidemic Act, will take effect in April.
Many cities now have bike share programs, but one type is causing problems for neighbors and businesses. As Cronkite News reporter Mari Nelson shows us, riders are abandoning their bikes in the wrong places.
These brightly colored bikes have been popping up all over the valley for anybody to use and ride to any location.
We just started seeing them on the streets all of a sudden. And then they just are everywhere now.
But people are complaining that some cyclists are littering the streets by dropping bikes in the middle of sidewalks and front yards.
People can just leave them on the street and they're not even worried about it.
We put the bikes in the right places, but one of the beautiful things about dockless bike share is you can kind of pick it up wherever you want and leave it wherever you're going.
Paul Vidal is the Phoenix general manager of the company OFO that owns these yellow dockless bikes. Scottsdale Transportation Director Paul Basha says residents have complained that bikes are being left where they shouldn't be.
Leaving somebody's private personal property on somebody else's private property is illegal and shouldn't happen. If a bicycle is blocking a sidewalk, that's illegal as well.
Vidal says they place the bikes so that people in wheelchairs or strollers can pass, and he expects his customers to do the same. But Basha says that some riders aren't, and they aren't being held accountable.
It is the business's responsibility.
It's our job to correct that immediately, address complaints when people report them ending there, and just find them on our own and move them around.
In Phoenix, Mari Nelson, Cronkite News.
People who find the bikes in their yards or sidewalks can't move them without the bike being unlocked through an app, but they can call the bike company to have it removed.
More Arizonans are giving the gift of life. I met with a Valley family who shared their story of a life-saving exchange.
No one thinks anything like this will happen to them.
For many new mothers, the first seconds with your newborn are filled with joy and wonder.
What color is this one?
But for Kaylin Crawford, it was filled with fear and panic.
Our diagnosis has just got worse.
Crawford was halfway through her pregnancy when doctors noticed something was wrong with baby Oliver's heart. He was born 7 weeks premature. Crawford said he came out blue and unresponsive.
I thought this was it. I just lost him.
That's when Oliver was immediately placed on an organ transplant list for a new heart.
His heart was just so weak and so sick. They just weren't sure if we would make it this far.
A donor was found almost immediately, and out of another family's tragedy, a miracle for Oliver. The heart was found to be a perfect match.
We just feel a part of them lives on, and that every first walk that Oliver got to take, it was a moment for our donor and their family as well.
Arizona saw a record number of organ donations in 2017 and are up 16% from last year, something Donor Network of Arizona spokesman Nico Santos says can do more than just save lives.
And over the last 5 years, we've seen an increase in the number of lives saved and an increase in the number of people who are deciding to register themselves as organ donors.
More than 700 lives were saved in Arizona last year because of organ donations, the largest Arizona has ever seen. But Santos says this is just the beginning.
Although 701 people are most likely very grateful, and we honor the heroes that donated to them, there's a lot of work to be done still.
It's all in an effort so people like Oliver can have a second chance at life.
Without organ donation, he wouldn't be here with us today.
There are over 2,000 people on the organ donation waitlist in Arizona. To register to become a donor, you can go to donatelifeaz.org.
The Me Too movement and many sexual assault accusations have sparked awareness and action around the world.
Here in Arizona, some women are making moves, literally, to protect themselves. Reporter Nicole Gutierrez has the story.
Women come in after the fact that they've been attacked.
At the East Valley Krav Maga Training Center, people, specifically women, are practicing an Israeli self-defense system to not be victims of any assault.
Everything that you learn is kind of broken down for you, so you try it slow, then you try it fast, then you try it with a partner. And it was a very simple method so that anyone from any background, any age, any physical fitness level could learn in a shorter time frame.
Krav Maga is a fighting system that was developed for the Israel Defense Forces. But here, it teaches students to use parts of their body in effective ways to target the most vulnerable parts of an attacker.
The most common attacks on females are things like choking and bear hugging from behind.
Hofrichter says it doesn't take a lot of muscle power to get out of a situation. You can actually use your body to leverage yourself out. Assaults at times may derive from cultural backgrounds, according to Hofrichter.
Male, in our culture, males are told not to hit women. You don't hit your classmates. And so it kind of creates this mentality where you cannot hit a woman. But then sometimes more in adulthood, in that moment of frustration, hands on the neck all of a sudden is okay.
A recent poll found that 60% of women in the U.S. have been sexually harassed. Hofrichter says that although many students who've come into the class have never experienced a type of assault, for some women who have, it's important to build their confidence up.
Maybe we're practicing a drill where they have to have their eyes closed and then they get attacked. Maybe take away the eyes closed portion of it and build her up from there.
In Tempe, Nicole Gutierrez, Cronkite News.
There's good and bad news in Arizona's fight against the opioid epidemic. Results were shared this morning at the second annual Opioid Crisis at Summit in Tempe. Cronkite reporter Mari Nelson was there to show us where Arizona stands with this epidemic.
Although progress has been made to defeat this opioid epidemic, the DEA says the problem is going to get worse before it gets better, and there is not just one party to blame.
If you want to point the finger, turn it around and point it at yourself. All right, every single one of us in this room is partially responsible for what's happening right now.
Doug Coleman, special agent in charge of the Phoenix DEA, spoke at the second annual Arizona Opioid Crisis Summit to address the real roots of this epidemic.
Doctors started prescribing, Big Pharma started producing them, the Mexican cartel started manufacturing heroin and fentanyls.
All of these things came together to produce the opioid crisis, which has already caused more deaths nationally than car accidents.
So why aren't we taking it more seriously?
According to the DEA, 2 people die each day in Arizona due to the opioid epidemic.
The Arizona Department of Health data shows us that there have been 5,800 possible opioid overdoses reported within the last 8 months. 15% of those were fatal.
Unfortunately, it looks like the problem is getting worse before it gets better.
Senior research analyst for the Justice Research and Statistics Association, Shanna Malone, shows a graph of 3 different kinds of opioids that show the steady increase of heroin deaths from 2007 to 2016.
If we don't double down and do something different now, that number's going to cross that red line of prescription opioids. It's only a matter of time.
The Arizona Opioid Crisis Summit is a chance for professionals from all fields to come together and work on a plan of action.
The problem has to be solved by all of us. The cops can't solve it by themselves. Treatment can't solve it by itself. Prevention can't solve it by itself. The medical practitioners can't. We all have to work together, and that's why these kind of conferences are important.
In Phoenix, Mari Nelson, Cronkite News.
Coleman hopes that the organizations there can make enough progress fighting the epidemic that there won't be a need to have an event next year. Cronkite News is dedicated to covering the opioid crisis. You can watch our documentary, Hooked RX From Prescription to Addiction, and find resources for getting help online at hookedrx.org. Mari Nelson, Cronkite News. Thanks for joining us for this special edition of Cronkite News. For more multimedia coverage, go to cronkitenews.azpbs.org and click on the Consumer tab.